You're listening to Health Professional Radio. My name is Wayne Bucklar, and my guest today is Richard Paterson. Richard's the Solutions Delivery Consultant at Electrotek, a Queensland-based firm in Australia. Richard, welcome to Health Professional Radio.
Thank you for having me.
Now, Richard, today our topic is a wireless dementia care product that your firm sells. Can you fill us in about how that works? It does sound intriguing.
Okay. We work in the domain of primarily in aged care, and we've noticed, and it's backed up by statistics, that there's a incredibly rapid trajectory upwards of the prevalence of dementia in residents in aged care facilities. In fact, recently I discovered through the Australian Institute of Health and Welfare that more than half the residents in Australian government subsidised aged care facilities actually have dementia. So what we were discovering was that there's a lot of residents with dementia, and there's a lack of beds in secure facility or secure sections in aged care facilities. And
half is an extraordinary number, Richard. That's got to be literally tens of thousands of patients.
Yep, that's according to the Institute of Health and Welfare, that's about just over 85,000 out of 164,000 permanent residents. That's the ones that have got the ACFI assessment, and that was in 2011. They're the latest statistics I could get. I suspect the percentage is probably heading upwards now.
And as all our colleagues would know who work in aged care, this is normally managed through secure facilities and purpose-built facilities for managing people with dementia, but there's not that many and they're expensive.
Absolutely, and the demand is a lot higher than the supply of beds. So that was something that we identified, and we believe that there was a need for, and that's being evidenced now as we move around the marketplace, that there was room for a solution where somebody that's a resident in an aged care facility and requires management because of their dementia status, they can actually stay in their current room, and this dementia profiler can be installed in their room, and then they can be managed appropriately. And the way this dementia profiler works is that we have an out-of-bed alert, which is generally a pressure mat in the bed, and then we have a movement, like they call it a curtain movement sensor above the door, so that if the resident does leave the room, it activates the alarm. But there's also a movement sensor in the ensuite. So if the resident gets up during the night, that the bed mat triggers that they've got up out of bed. That's fine as long as within a given time frame they enter the bathroom, because there's a good chance they've got up to go to the bathroom during the night. So that's fine. And then that continues to be fine as long as they get back into bed within a given time frame. So if they don't make it to the ensuite, that'll set off an alarm through the nurse call system. And similarly, if they don't get back into bed in a time frame, that will set off the nurse call system as well. And as I mentioned before, if they leave the room, that will be detected and trigger an alarm as well. So basically what that means is that you can secure the room. They can move about, get up and go to the toilet, that sort of thing. And as long as they operate within given time frames and parameters, then there's no effect and no need for attention. But then as soon as they operate outside of those parameters, the dementia profiler is then linked in through the nurse call system, and then there would be an alert put through the nurse call system. The beauty of this system is that it's wireless, so there's very little installation required, so that the system can actually be set up in a given room without a whole lot of fuss and bother, and not a massive amount of labour in order to set this up. And the system is icon driven, So it's like a screen, like a small iPad screen, like a tablet screen, and it's a touch screen, and basically it's just icon driven. So if you want to arm the bed, there's a little picture of a bed, you press that arms the bed. If you want to arm the movement detector in the ensuite, there's a little picture that depicts an ensuite, you do that, and the doorway, you hit that. If you do all three, then it goes into full dementia profiling status. If you just do, for example, if the resident is just in their room and you just want to know if they leave the room, you can just arm the detector over the door. So you can either arm individual components or collectively. Once it's done collectively, then it goes into full profiling management operation.
Now, Richard, many of our listeners, as you know, are clinicians of one kind or another, and a lot of them work in aged care. Have you had any feedback from clinicians working in aged care about how the system's affected their working life?
Absolutely. The first thing is that, look, I'm not suggesting that we're the only business around that has a dementia profiler. There are other options available to people. However, the feedback, primarily the positive feedback that we get is how simple our system is to operate. It's just a case of pressing buttons, and it's all icon driven, so you don't need a whole lot of programming experience or intelligence to turn the system on and off and to operate it. And secondly, it does give a lot of peace of mind to the staff so that they can actually manage somebody that probably perhaps should be in a secure wing, but if there's no room and vacancy available, then that's not possible. Then this is kind of the next option. And there is a hardwired version, and in fact we have been asked in a number of facilities that are being built or renovated to actually pre-wire every room for dementia management, because most of the management of aged care facilities looking forward believe that it's going to be an increasing need. And also, as anybody that's worked with anybody in the dementia spectrum realises that the dementia tends to accelerate when somebody is relocated.
Yes, I have spoken with a number of people who work in aged care who say one of the problematic aspects is that when you've got a patient who kind of, maybe should be in a dementia care room, the act of shifting them out of their familiar environment often triggers that to an extent that it's kind of a self-fulfilling prophecy for them.
Yeah, and it is one of the very common triggers for accelerating the severity of the dementia. So clearly, if you can manage somebody, this aging in place philosophy that if you can manage somebody without relocating them, that's obviously going to be ideal. In fact, I was just talking to a facility last week. They don't have a secure wing, and they had somebody who started getting disorientated and was a risk of wandering off. So they actually had to relocate them to a different facility because they needed to be in a more secure environment. So that increasingly that's going to become the case.
Now, Richard, you mentioned ageing in place there. Is it a system that can be used by carers in the home?
Potentially it could. I mean, it really sort of needs to be utilised in conjunction and as part of a nurse call system.
Yes.
I mean, theoretically you could use it to even, to dial for alerting off-site. So you could have like a dialer type situation where, if they break the system, if you like, then that could dial out, for external help. And it certainly, the simple answer is yes. I'm not sure how practical it would be in that sort of application.
Yeah, so it's something to bear in mind. I was actually thinking of friends of mine who are caring for their parents at home, and wondering if it might be of use to them, but that's within the one house. So
there is one application of it that some people call it the moth to the flame strategy. So that part of what it does is that if the resident does get up, is detected as getting up out of bed, and the system is in full management mode, then it can be wired up to turn on the light in the bathroom, so that when the resident, goes to get up, the light goes on in the ensuite to remind them that that's what they were getting up for.
You see, I need one of those just so I can find my way to the ensuite.
Well, I want one for the fridge. So, it's the fridge I usually get up for during the night. So then they can do that, and you can actually have it also then so that it could then trigger after a given time. It can then trigger a bedside lamp, right. Similarly in reverse mode to go back to bed.
Richard, it's been a pleasure talking to you about it today. For people who are looking for more information about a dementia management wireless product from Electrotek, how can they get in touch with you?
Probably the best thing they could do is give me a call on my mobile, which is 0403 588 417. That's 0403 588 417. And we do have a range of other products and so forth available. We do a lot of work in dementia management. We have resident wandering systems and so forth as well to ensure that disorientated residents don't wander out of the facility, or if they do wander out of particular areas, they're detected and so forth. So it's kind of, we take a bit of an integrated approach, and we can, if there's something we don't have, we can always create something where we're very much focused on filling the need as the client comes to us with a need, finding the right solution for that particular need. It's not just always one size fits all or taking something off the shelf to give them. The whole philosophy of how we work is to engage with people that have a need and work out what a solution to their need would be.
Richard Paterson, Solution Delivery Consultant at Electrotek, thank you very much for your time. I do appreciate it.
Thanks very much. Thank you for the opportunity of going to air with you guys. Appreciate it.
It's our pleasure. If you've missed my conversation with Richard, the good news is we have a transcript on our website at www.hpr.fm. You can also find more information on the Electrotek website at electrotek.com.au, or you can listen to the full interview on both YouTube and SoundCloud, and there are links to that on our website as well. My name is Wayne Bucklar. Thank you for joining us today on Health Professional Radio.